Hi there, this is Nursing Education Videos. Today I will be reading Hyponatremia NCLEX Review on registerednursern.com. All credit for this information that I am reading goes to Sarah at registerednursern.com. All credit for this information again that I'm reading is from registerednursern.com. Please refer to the websites in the description box for all credit and information. Are you studying hyponatremia and need to know some mnemonics on how to remember the causes, signs and symptoms, and nursing interventions? This article will give you some clever mnemonics on how to remember hyponatremia for nursing lecture exams and NCLEX. In addition, you will learn how to differentiate hyponatremia from hypernatremia. Don't forget to take the hypernatremia and hyponatremia quiz. In this article, you will learn normal sodium levels, 3 types of hyponatremias, causes of hyponatremia, signs and symptoms of hyponatremia, as well as nursing interventions for hyponatremia. Hyponatremia. Hypo means under/beneath. Natra, so N-A-T-R, is the prefix for sodium. Emia, E-M-I-A, means blood. Meaning of hyponatremia is low sodium in the blood. Normal sodium levels is 135 to 145 milliequivalents per liter. Less than 135 equals hyponatremia. Role of sodium in the body. An important electrolyte that helps regulate water inside and outside of the cell. Remember that water and sodium loves each other, and wherever sodium goes, so does water. Learn about hypertonic, hypotonic, and isotonic solutions on registerednursern.com. For example, in hyponatremia, sodium outside of the cell is very low, and this causes water to move inside the cell. In turn, the cell will swell, and you will start to see problems in the body, especially with brain cells, which is confusion. Sodium also plays a role in muscle, nerves, and organ function. Types of hyponatremia. Volemic hyponatremia is where the water in the body increases, but the sodium stays the same. The causes include SIADH, syndrome of inappropriate antidiuretic hormone secretion, which is due to the increased amount of secretion of antidiuretic hormone. This hormone retains water in the body, which dilutes sodium. Other causes: diabetes insipidus, adrenal insufficiency, Addison's disease, etc. Hypovolemic hyponatremia is another type, which is where the patient has lost a lot of fluid and sodium. The causes is due to vomiting, diarrhea, nasogastral suction, so NG suction. Let me double check that. Yes, it is nasogastric suction, and then diuretic therapy, burns, and sweating. Hypervolemic hyponatremia is where the body has increased in fluid and sodium. However, sodium decreases due to dilution, and because total body water and sodium are regulated independently in the body, the causes of hypervolemic hyponatremia is congestive heart failure, kidney failure, IV infusion of saline, and liver failure, etc. Causes of hyponatremia. Remember mnemonic no, Na plus. N for Na plus. So N for Na plus, it's the sodium ion. So it means Na plus excretion increased with renal problems. Ng suction, because the GI system is rich in sodium. Vomiting, diuretics, sweating, diarrhea, and decreased secretion of aldosterone, which is a wasting sodium hormone. O for overload of fluid with congestive heart failure, hypotonic fluids infusions, renal failure, because renal failure dilutes sodium. And Na plus means so Na intake low through low salt diets or nothing by mouth. And then A for antidiuretic hormone oversecreted. SIADH, so syndrome of inappropriate antidiuretic hormone secretion. Retains water in the body, and this dilutes sodium. Signs and symptoms of hyponatremia. Remember mnemonic salt loss. S for seizures and stupor. A for abdominal cramping and attitude changes, so confusion. L for lethargic. T for tendon reflexes diminished, trouble concentrating, confused. L for loss of urine and appetite. O for orthostatic hypotension and overreactive bowel sounds, or actually it's overactive bowel sounds. S for shallow respirations, which happens in the late stages due to skeletal muscle weakness. S again for spasms of muscles. Nursing interventions for hyponatremia. Watch for cardiac, respiratory, neural, renal, and GI status changes. Other interventions are nursing interventions for hypovolemic hyponatremia, which is to give IV sodium chloride infusion to restore sodium and fluids. So 3% saline hypertonic solution. It's harsh on the veins, given in ICU usually through central line very slowly. Must watch for fluid overload. Hypervolemic hyponatremia, you treat this by restricting fluid intake and in some cases administer diuretics to excrete the extra water rather than sodium to help concentrate the sodium. If the patient has renal impairment, they may need dialysis. Nursing interventions for hyponatremia that is caused by SIADH or antidiuretic hormone problems, which is fluid restriction or treated with an antidiuretic hormone antagonist called declomycin, which is part of the tetracycline family. Don't give with food, especially dairy or antacids. It binds to cations, and this affects absorption. If patient takes lithium, remember to monitor drug levels, because lithium excretion will be diminished and this can cause lithium toxicity. Instruct to increase oral sodium intake and some physicians may prescribe sodium tablets. Food rich in sodium include bacon, butter, canned food, cheese, hot dogs, lunch meat, processed food, and table salt. I hope this information was helpful and engaging. Please feel free to subscribe and click the link in the description box and click the like button and go to registerednursern.com for more information.